Welcome to This Explainer. Today, we're diving into a real scientific detective journey all about oral health. We'll be following the fascinating research of Professor Dr. Ahmad Seton to explore a mystery that, honestly, affects pretty much every single one of us. We're going to peel back the curtain on the hidden biological world inside our mouths, take a hard look at the everyday products we use to clean our teeth, and ultimately, discover a completely natural, health-boosting alternative. Let's kick things off with a frustration I know we all share.
Look, it's a universal frustration, isn't it? You brush, you floss, you do literally everything right, and yet you still end up sitting in the dentist chair getting a cavity filled. Dr. Seton points out that we're actually in the middle of a tooth decay epidemic right now. This is especially true for kids who are constantly snacking on sweets and processed carbs. I mean, despite all our modern dental hygiene, our teeth are just under constant attack. So what exactly are we missing here? Why isn't the daily scrubbing doing the trick?
Well, that brings us to Section 1, the mouth's hidden ecosystem. Because to really solve this mystery, we've got to stop thinking of our mouths as just, some surface to be aggressively scrubbed and start treating it like the delicate habitat it actually is.
There is literally a microscopic battle happening in your mouth every single day. On the one side, you have your body's built-in shield, saliva. When your mouth is healthy, your saliva is naturally alkaline. It's packed with sodium bicarbonate, which is basically baking soda, and protective enzymes that neutralize acids. But on the other side, you have the primary attacker. This is an acidic environment driven by a bacteria called Streptococcus mutans. And this bacteria, it absolutely thrives on the sugar and carbs we eat, constantly trying to tilt that delicate balance from alkaline straight to acidic.
And when that balance finally tilts, a cavity forms. And it happens through a very precise biological process. Step 1, you eat sugar or processed carbs, and that Streptococcus mutans bacteria just feasts on the leftovers, creating a sticky biofilm right on your teeth. Step 2, as they gorge on this sugar, they excrete acid. Step 3, this acid actively eats away at your tooth's outer layer, the enamel, in a process called demineralization. And finally, Step 4, if that decay isn't stopped in its tracks, it creates a hole that reaches all the way down to the nerve. And we all know that means severe pain and usually a root canal. Right, which leads us to Section 2, the commercial toothpaste trap. Because if we know exactly how cavities form biologically, we have to ask a kind of uncomfortable question. Are modern toothpastes actually making the situation worse? Dr. Seton points out that a lot of commercial toothpaste contain up to 10 different chemical ingredients. Take fluoride, for instance. Now, while it's intended to strengthen enamel, it's definitely a double-edged sword. It's toxic in large amounts and actually competes with essential iodine in your thyroid. Then you've got sodium lauryl sulfate, or SLS. That's the stuff that creates that foaming action we're so used to, but it's really just a harsh soap-like irritant. And chlorhexidine, it's meant to kill bad bacteria, but it's so aggressive, it's basically like dropping a nuclear bomb in your mouth. It wipes out your good bacteria right along with the bad, totally destroying your natural microbiome balance. And, this isn't just some academic theory for Dr. Seton. It's incredibly personal. He actually notes that despite his extensive medical background, his own teeth suffered heavily. We're talking numerous fillings and root canals, all while using standard commercial toothpastes. It was this exact personal frustration that drove him to seek out natural biological methods that actually work with the body's natural defenses, rather than just bombarding them with harsh chemicals.
So let's talk about how to do that in Section 3. Building internal defenses. Because true oral health isn't just about what you smear on your teeth, it actually starts from the inside out.
Think about it. Your teeth are structurally made of proteins and minerals. So naturally, Dr. Seton emphasizes a diet rich in healthy proteins like meat, fish, and eggs to support that structure. Also, eating crunchy vegetables and high-fiber foods literally acts as a natural toothbrush. It mechanically cleans your teeth as you chew. It's like nature's broom. As for vitamins, you absolutely need vitamin D, and you have to pair it with vitamin K2 to properly deposit calcium into the teeth where it belongs. And to boost your mouth's immune response against those bad bacteria, you're going to want plenty of vitamin C, zinc, and selenium.
But beyond just the standard vitamins, Dr. Seton highlights this absolutely incredible natural tool, xylitol. Now, xylitol is a natural sugar alternative, but in your mouth, it acts like a Trojan horse against bad bacteria. When you consume it, and you'll often find it in natural chewing gums, it stimulates your protective, alkaline saliva. But here's the best part. The Streptococcus mutans bacteria try to eat it, but they literally can't metabolize it. So it prevents them from sticking to your teeth, completely stops them from producing acid, and effectively starves them out. Honestly, chewing xylitol gum right after a meal is a total game changer. All right, we made it to section 4, the masterclass on immunity-boosting toothpaste. It is time for Dr. Sutton's comprehensive, all-natural toothpaste recipe. For the base, you're going to need 1 tablespoon of coconut oil, which is a powerful natural antibacterial agent. Mix that together with a tablespoon of olive oil for its soothing, anti-inflammatory properties. Then add the magic ingredient, 1 tablespoon of baking soda. Remember how healthy saliva uses bicarbonate to stay alkaline? Well, baking soda mimics this perfectly, neutralizing acids while gently whitening your teeth. Oh, and you can toss in a half a teaspoon of honey for taste if you want. Next up comes the active botanical phase. You'll add a half teaspoon of finely sifted costus root to really boost immunity, plus a half teaspoon of ground clove. Clove is amazing because it fights bacteria and gives this really nice, mild, numbing effect for sore gums. Follow that up with a half teaspoon of myrrh, which is a super potent natural antibiotic, and a half teaspoon of ground black seed. Now, quick pro tip here, just make absolutely sure everything is ground incredibly fine, so it doesn't end up being abrasive to your enamel. And to finish off this medicinal paste, you're just going to add 2 final boosters, a pinch of turmeric and a pinch of black pepper. Turmeric is widely recognized as one of nature's strongest anti-inflammatories, making it absolutely perfect for fighting off gum disease. And the little pinch of black pepper, that's just there to help activate the turmeric so your body can actually use it. Okay, so once you have all your ingredients together, you simply mix them thoroughly until they form a nice, smooth paste, and store the whole shebang in a small, closed container. Dr. Sutton recommends using a soft, bristled brush to apply this natural paste about 3 times a day. And honestly, here is the most amazing part. Unlike commercial toothpaste that literally comes with poison control warnings on the back of the tube, this recipe is entirely food grade. It is incredibly safe for children to use. In fact, if they happen to swallow it, well, the oils and herbs will actually work to boost their internal immunity. No harm done. Wow, we've really covered a lot of ground today, haven't we? From the delicate, microscopic ecosystem living right there inside your mouth, to the hidden pitfalls of those everyday chemical toothpastes, and finally, a completely natural, empowering recipe from Dr. Sutton to help you take back control of your oral health. So the main takeaway is this: you actually have a choice in how you protect your body. Try a natural and a healthy toothpaste.
By Prof. Dr. Ahmad Setin.
Seriously, knowing what you know now about your mouth's natural microbiome, what will you put on your toothbrush tonight? Thanks so much for watching and keep exploring.